Let me ask you about a concern that has been expressed by an op-ed recently in the New York Times about whether people who are minorities are being adequately represented in the COVID-19 phase 3 trials. What can you say about that?
Well, we are trying as best as we possibly can to get equitable representation of African Americans, Latinx, and other minorities. We're doing better with the Latinx, but still we have to do much, much better with the relative percentage of African Americans that are in the trial. It's a good reason for that, David, because when the trials ultimately get shown to be safe and effective with regard to the candidate vaccines, we want to be able to say with confidence that they are safe and effective in all demographic groups.
Now, there's a concern in the minority community, I believe, that when the vaccine is available, wealthy white people will get it first, and then it will trickle down, and the last people to get it will be minorities who might need it better or more than wealthy white people. What can you do to assure people that people of minority backgrounds will be getting this in the same fair way that it should be distributed?
Well, there will be a prioritization. I mean, classically, notwithstanding COVID-19, whenever there is a shortage of vaccine in the sense of when you're rolling it out and you don't have all the doses, classically, the Advisory Committee on Immunization Practices advises the CDC, who makes that determination about what prioritization is going to be done. We're complementing that with another group from the National Academy of Medicine, which has recently met to also give a recommendation. We don't know exactly what the decision is going to be, but I can tell you, David, from past experience, clearly people who can benefit from the vaccine the most and those who are at the highest risk of serious complications will be in the higher priority. Almost certainly, the first priority will be the frontline workers, the people such as the healthcare providers who put themselves at risk. But close behind them will very likely be people who could benefit the most, and almost certainly that would include minorities.
Well, but minorities very often might be in the lower income strata. Suppose they say, yes, thank you for putting me at the front of the line, but I can't afford to get the vaccine. What are we going to do as the U.S. government to make certain that people that can't really afford it will get it?
Yeah, well, you know, that was a very important question, David, and we were at the task force meeting and said, when we got asked that question, will the government make sure that that is not the case, that people who cannot afford it, as it were. First of all, people need to understand the vaccine itself is free. The federal government has pre-purchased those. So the vaccine itself is free. If there's any fee, it's going to be associated with the administrative aspects of administering the vaccine. And that should not be something that gets in the way of poor people receiving it.